These are tough times, aren't they? The coronavirus is grappling the world. A lot of people are suffering, and the brave heroes, the doctors, the nurses, are on their duty 24/7 to save our life from this monstrous virus. So, my name is Raghav Gupta, and I, with Shashank Shekhar, Pratham Gupta, Geetika Reddy, and Vedic Patel, made an application to help small hospitals and clinics to handle their patients' data. When we were choosing our project, we wanted to choose a project which was having both real-world application as well as a dedication towards these frontline warriors. We started building upon various ideas and at the end figured out a problem that a lot of low and small clinics in many states and even in many countries like in Africa, they still use registers to store the data of their patients. We wanted to digitalize that thing. So we made an application that is 99% compatible with all the Android devices present on this planet and is low on resources. Let's find out about that.
Okay guys, so coming to the working of our app here, we have 5 sections here. For the first section, if you are a new patient, you have to just click that button. Then you have to enter a name and age and just click next. Then you have to enter your address and mobile number. As soon as you click this proceed button, your all details will be saved in our database. Then you have to just enter your general purpose for a visit in hospital. For an example, if I just click this general checkup button, a fee receipt will be generated and then I have to pay this amount at the cash counter. So if you are an old patient, then you have to just enter mobile number here and then click next. Your all details will be fetched from our database. Your all details, you can discharge yourself from this app only, and your whole nurse and doctor visits will be counted in this section. So when you have to see your details, you can just click on the old patient button and just you have to enter a mobile number, and then you will get your all details in just one click. Thank you.
The Earnings Till Now button will display the earning of the hospital. The Reset Earning option will reset the earning, and the Developers option will display the name of the developers.
Now let's talk about the advantages. First of all, it's a user-friendly app. That means it's very easy to use. Secondly, it's easily available since nowadays almost everyone can afford an Android. And we also made it in a way so that it can run even on Android KitKat and obviously the later versions. And we also purposely use the dark theme so that it won't strain the user's eyes and will also consume less battery. And lastly, it's free.
Let us talk about the disadvantages now. Firstly, medical data is stored in the local storage and not in cloud, and so data cannot be shared among other devices. Second, data is not encrypted due to low-end processes and hence less storage capacity. And lastly, our application has limited functionality, but we intend to rectify these situations in the future.
So talking about the future implications of our app, the first is the most important feature that we will include in our app is the online payment system. And the second is the most necessary feature is the data security and cloud storage, which will process the large amount of data provided by the customers and the patients. And the third, which is the most interesting and unique feature, is the one-to-one interaction with your healthcare expert. Yes, you can video call them and text them as the prescribed time given to you.
70% of healthcare organizations are expected to invest in medical mobile apps, with an estimated spend of 1.5 trillion US dollars on wearable health monitor technologies and mobile apps. This rising trend of remote healthcare, coined House Calls Plus, has allowed for a more timely administration of treatment for patients at their homes, significantly reducing the cost of intervention, as well as improving the quality of care. Pilot programs are showing excellent results, with one program in the U.S. reducing admission rates to hospitals by 18% for its diabetic population who use remote monitoring and communication, and their readmission rates have also dropped by 31%, all of which reduced costs to the test center by 7%. An alternative to hospital-run healthcare programs is the drive towards patients using wearables and other personalized technologies to receive a variety of readings, which they can directly compare to a number of benchmarks and decide whether or not to proceed to a healthcare professional. Other patients may instead choose to consult health social networks to share information from their automated readings, consult a physician during Q&A sessions, or even seek emotional support. Patients may also use apps to detect a correlation between their condition and medication interactions or bad health practices to make decisions on how to improve their health. For more in-depth testing, patients could also decide to use home kits for personalized genomic services, blood and other biomarker testing, environmental testing, and even predictive biosimulation. Such a style of healthcare is being termed local convenience store. For those who choose to consult a healthcare expert, a number of options may arise that redirect the patients away from the hospital. Retail outlets in common city centers and clinics in remote locations can receive patients, review their information, and decide whether to continue with further care by a physician. On-call doctors are also readily available to answer questions and provide healthcare directives through video chat, email, or mobile phones to patients anywhere. Telemedicine has grown exponentially, with 72% of hospitals and 52% of physician groups in the U.S. currently providing such services. And in Ontario, Canada, telemedicine programs have seen an annual growth of about 30% for the past few years. Among the risks associated with advancing personalized technology in healthcare is the belief that technology will take over the role of the doctor. In 2017, 142 million medical and health apps are expected to be downloaded, and an estimated 65% of consumer healthcare transactions are to be made using mobile devices. Nevertheless, hospitals and healthcare professionals will still be at the forefront of all treatment plans, especially in unique cases. Therefore, the new dynamic of doctor-patient relationships requires new collaborations and business models, as well as a revised understanding of healthcare companies' role in the value chain.